The next dosage form is biphasic liquid dosage forms. As the name itself indicates, see, biphasic liquid dosage forms means the liquid dosage forms which are having two phases. So, which you can clearly see the two different phases. So, the phases like oil and water, if you see, oil and water doesn't mix with each other. So, when you mix oil and water, you can clearly see the two phases in any beaker or any chamber when you mix oil and water. So that is why this type of dosage forms are called as biphasic liquid dosage forms. In that, the first one is emulsions and suspensions. So see, emulsions are nothing but these are biphasic liquid dosage forms which contains two immiscible liquids. Two immiscible liquids that are made miscible by the addition of a surfactant. So these are two immiscible liquids. Immiscible liquids means what? Immiscible liquids means nothing but they cannot be mixed with each other. Those liquids cannot be mixed with each other. So that is why they are called as immiscible liquids. You take oil and water. When you mix oil and water, they are not mixed with each other. So that is why they are called as immiscible liquids. But these are mixed by the addition of a surfactant. Surfactant is a compound which will be added for mixing these immiscible liquids. When you add surfactant, then these two immiscible liquids can be mixed with each other, but when you see that mixture, it will look like two phases. So that is why it is called as biphasic liquid dosage form, in which the first one is emulsions. Emulsions means what? Emulsions means these are the biphasic liquid dosage forms which contains two immiscible liquids. Immiscible means these are not mixed with each other. Two immiscible liquids which are miscible means that are mixed by addition of a surfactant, and these are very two types, that is oil in water emulsion and water in oil emulsion. Oil in water emulsion means what? When you mix oil into the water, that is called oil in water. When you mix water into the oil, that is called water in oil emulsion. Next one, suspensions. So suspensions are the biphasic liquid dosage forms of medicaments in which the finely divided solid particles are dispersed in liquid vehicle. Here what we will do? We will mix solid particles, means solid drug particles, that are solid powders or crystalline powders, like that. We will mix the solid particles in a liquid vehicle. That is called as liquid vehicle. Means when you take water or you take alcohol or you take any oil, when you mix these solid particles into that liquid particles, that type of dosage form is called as suspensions. That type of dosage form is called as suspensions. And these are again four types you see: oral, parenteral, topical, and ophthalmic. So these may be, when these are taken to oral route, they are called as oral suspensions. When they can be given through parenteral, they are called as parenteral suspensions. When they are given through topical route, they are called as topical suspensions. When they are given through ophthalmic route, they are called as ophthalmic suspension. The next one is semi-solid dosage forms. So semi-solid dosage forms are again different types. They are ointments, creams, paste, jellies, and suppositories. So the first one, ointments, you see here. Ointments are semi-solid preparations which are made mainly for the external application onto the skin. So the ointments where you will apply, the ointments cannot be taken through the oral route. You cannot take through mouth ointment. What you will do with ointment? Ointment is externally applied onto the skin. Ointment you can apply externally onto the skin for curing something. And the next one, they usually mainly contain medicaments. The medicaments are in dissolved, suspended, or emulsified in an ointment base. Means nothing but there is an ointment bases will be there. Different types of ointment bases are there. In those bases, we will dissolve, or we will dissolve means what? We will mix, or we will suspend. Suspend means what? When you add solid particle to liquid particle, that is called suspension. Next, emulsification. Emulsification means what? When you add oil in water or water in oil, that is emulsification. So medicament is dissolved, suspended, or emulsified in ointment base. So these are called as ointments. Next, creams. Creams are viscous semi-solid emulsions, means they are very thick. Creams are very thick semi-solid emulsions. Emulsions means what again? Emulsion means you always remember when you add two immiscible phases like oil and water. So here cream is prepared by adding an oil and water phase with some medicament. So these are used for what? These are used for external applications. These cannot be taken through oral route. These are only used for external application onto the skin. And these are having soft consistency. The creams are always soft consistency and light in weight. There are mainly two types, that is aqueous creams and oily creams. When you take aqueous vehicle, that is aqueous cream. When you take oily vehicles, then it is called as oily creams. Next, paste. Paste are also semi-solid preparations which are mainly intended for external application to the skin. Pastes can also be applied to the externally applied onto the skin. These pastes mainly provide protectiveness, absorptive and antiseptic properties. Next, jellies. So jellies, you know, jellies are transparent or translucent, non-greasy semi-solid preparations. These may be transparent or these may be translucent, non-greasy semi-solid preparations. These are not greasy, but they look like that, but these are not greasy. The non-greasy semi-solid preparations. Then where we apply jellies? Jellies also can be applied only on the skin. So these may be medicated jellies are there, and there are lubricated jellies are there. Next, suppositories. So what are suppositories? Suppositories are semi-solid dosage forms of medicaments which are inserted into the body cavities other than the mouth. So suppositories cannot be inserted into the mouth. These are inserted into the different body cavities other than the mouth. So these may be inserted into rectum, or these may be inserted into vagina, or these may be inserted into your nose, or these may be inserted into your ear. So for curing different infections, we will insert these suppositories into your rectum, vagina, nose and ear or some other parts except the mouth. So these are called as suppositories. So what is the main functioning of these suppositories? They will dissolve at body temperature. When you insert this suppository in any part, they will immediately dissolve. They will dissolve and they will provide the drug into that part. So that is called as suppository. Next, poultices. So what are poultices? Poultices are soft, viscous, wet masses. You can see there the poultices. Multan, you call it as multan matti. Some multan matti will be available as a poultice. So you can see here, poultices are soft, viscous, wet masses of solid substances which can be applied to the skin for the fermentation and fomentation action in order to provide relief from pain or to reduce inflammation or to act as a counter irritant. These poultices, what are the actions of these poultices? These poultices mainly relieves the pain. If any pain occurs at some part of your body, when you apply these poultices, then it may relieve the pain. And inflammation. Inflammation means what? You always remember in pharmacy, inflammation means swelling. Inflammation means swelling. When your skin, whether somewhere because of some wound or because of some injury, some swelling occurred into your skin, then you have to apply this poultices. When you apply this poultice, then the inflammation can be reduced. And this can be applied to the affected part after heating with occasional stirring. So you have to heat it and you have to stir it, and then you have to apply onto that part. So that is why these are called as poultices. So those are about the semi-solid dosage forms and biphasic liquid dosage forms. And now we will see solid dosage forms. So these you know very well, solid dosage forms, mainly tablets, capsules, powders and granules. So you see tablets. Tablet. What is a tablet? A tablet is a solid unit dosage form which contains medicament. A tablet is a solid unit dosage form which contains medicament. You know, tablet is a solid dosage form. It looks like a solid. So solid single unit dosage form which contains medicament, and medicament is compressed to form round, oval or square shape. So the tablets can be available in round shape, oval shape or square shape. What are tablets? First of all, tablet is a solid unit dosage form with medicament. Okay, and these may be uncoated tablets are there, coated tablets are there, buccal and sublingual tablets, effervescent tablets, chewable tablets, lozenges and pills. Many types of tablets are available. See the coated tablets. The coated tablets looks like that. You can see the difference between sugar coated tablet and film coated tablets. It's sugar coated tablet. What is sugar coated tablet? Why we have to coat with sugar, sucrose? Why? Because nothing but to obtain the sweetness to the tablet. Many are having bitterness. Many tablets will be having bitterness. To obtain that sweetness to the tablet, to obtain good color and sweetness to the tablets, we will coat with sugar. So those are called as sugar coated tablets. Next, film coated tablets. Film coated tablets are mainly, these tablets are coated with film. Why? Because why these are coated with film? To obtain the sustainability, to obtain the sustainability and for prolonged, for to show the tablets, to show the prolonged period of time, to show its action for the prolonged period of time, we will coat with film. And enteric coated tablets are there. So these are the different types of tablets. And next, buccal and sublingual tablets, you can see very well. So sublingual and buccal medication. Sublingual tablets means what? The tablets which can be placed under the tongue. The tablets which can be placed under the tongue are called as sublingual tablets. And the tablets which are placed between the gum and the cheek of your face. So when you place the tablet between the gum and the cheek in the buccal portion, that type of tablets are called as buccal tablets. These tablets will dissolve rapidly and can be absorbed through mucous membrane when they enter into the bloodstream. So they can be dissolved very rapidly, very fastly, and they enter into the bloodstream very fastly, and it will show its effect. So based on the position, they are called as, see, if you place it under the tongue, they are called as sublingual tablets. If you place it between the gum and the cheek, they are called as buccal tablets. Next one, effervescent tablets. See, effervescent tablets are uncoated tablets that generally contains two things. They are citric acid and tartaric acid. The effervescent tablets mainly contain citric acid and tartaric acid, and also it contains carbonates or bicarbonates. And when you place it in the water, when you place these effervescent tablets in the water, it immediately releases the carbon dioxide. Immediately releases the carbon dioxide. Mainly some gas tablets are there which can be used for this purpose. So this type of tablets are called as effervescent tablets. Next one, chewable tablets. This you know very well. Chewable tablets, vitamin C tablets, you know very well. When you take these tablets, you can chew this tablet, you will get good taste with the tablet, but it will provide some vitamins to your body. So they are chewable tablets. Next one, lozenges. So lozenges are also solid preparation which contains sugar and gum. You can see the lozenges. It will look like gels you eat, the tasty gels you eat. So these look like that. So lozenges are the solid preparations which contain sugar and gum. And you can take it. It will provide you good taste, and it can cure your whatever infection is there. It can also cure that infection. It is taken through mouth and throat. Next, pastils. So pastils, you can see here pastils. Pastils are the solid medical preparations which are dissolved slowly in the mouth. When you keep these pastils in the mouth, they are very sweet in taste, are very, what can I say, salty in taste or sweet in taste, and they are designed to dissolve slowly. Means when you keep it in mouth, they will be dissolved slowly into the mouth, and they will provide this action. So these are called as pastils. Next, pills. Pills are also solid oral dosage forms which are having spherical shape. This looks like tablets, but these are spherical in shape, which are prepared from one or more medicaments. Now the pills are not used. These pills are used very rarely nowadays. Before olden days, the pills are used. Next, capsules. Capsules, you know very well, the capsules are self-contained oral dosage forms in which the medicament is placed. Medicament and excipient are placed in an empty gelatin shell. The one you are seeing is the gelatin shell. In that gelatin shell, the medicament is placed, and that gelatin shell is taken into your body. When the gelatin shell is taken into your body, then it will dissolve and it will provide the drug material into the bloodstream. So that is the use of the capsule. Next, powders. Powders are mixtures of finely divided drugs. Some drugs, they can be taken as powders. Directly, you can divide the drug and you can mix some excipients, and that is directly taken as powders into the external use. Next, granules. Granules are free-flowing powders. The difference between powders and granules is powder is amorphous in nature. Granules, they look like solids. They are spherical in shape. And these granules can be taken as in sachets. You see, you know very well, for gas problem, most of your parents or any other relatives, they will take Eno. So what is Eno? Eno contains granules. You have to mix it in water, then you have to take that water. The granules are mixed completely in water. When you take that water, it completely reduces your gas. So that is about granules. Next, gases. So pharmaceutical gaseous dosage forms can be defined as an aeroform substances. Aeroform substances. Why these are called as aeroform or pressurized aerosol substances? Why? Because when you press it, it will provide the drug in the form of gas. When you press the container, it will provide the drug in the form of gas. So that is why they are called as aerosols. They will provide the drug into the air, and that will be inserted into your nasal cavity or into mouth, and it will relieve the pain. Or some painkillers are there. Painkillers can also be used as an aerosols. So some aerosols, when you place it or when you press it onto your skin, whatever the pain is there on your skin, it can be relieved. So these are the gaseous dosage forms. Aerosols. Aerosols are the gaseous dosage forms. So aerosol, this is about aerosol. The aerosol, you know very well, many places you see this type of aerosols. This contains, see, mainly the pressure is there in that bottle. When you apply, when you press the upper button, then it releases the pressure and it releases the drug outside. And then it will cure. It is used for some nasal problems, and it can also be used for some mouth problems and for inhalation purpose. When you take as an inhalational aerosol, what it does is it will relieve, if any problem is there in the lungs, it will relieve that problem. So that is the use of the aerosols. And inhalers. So what is the use of the inhaler? When you take inhaler, it clears the lungs. Whatever the, if any air passage is obstructed in the lungs, air passage is obstructed, when you take this inhaler, when you press it, it will clear that passage and it will clear your nasal portion. So mainly asthma patients take these inhalers. Next one, parenterals. Parenterals, what we have to do, the parenteral is directly inserted or introduced into your body through bloodstream. So it may be different types. Through bloodstream, it is inserted directly into your body. They are called as parenterals. So these are the sterile dosage forms which are mainly administered into the body by means of injection, infusion, or implantation. So these may be two types, that is a small volume parenterals are there, large volume parenterals are there. Small volume parenterals, which are taken in smaller volumes, and large volume parenterals, the parenterals will be available in larger volumes, and the different dosage forms can be taken as parenterals. They are powders, solutions, suspensions, and emulsions. These can be taken as parenterals. So this is about dosage forms topic. Totally we have discussed regarding monophasic dosage forms, biphasic dosage forms, and semi-solid dosage forms, and liquid dosage forms.